Hey YouTube, it's Marida and welcome to another edition of the Nurse Lounge. And in this edition, we're actually going to talk about hashtag representation matters. You want to see what I'm talking about? Please stay tuned. Back. My name is Dr. Marida P. I'm a registered nurse. I've been a nurse for 16 years. I am an OB/GYN, well baby nursery nurse. I'm a nurse educator, associate professor, doctorally prepared, work at HBCU, and coming to you with another topic on representation in nursing. So when we use the hashtag representation matters, what does that actually mean? Well, it depends on who you are. But in this particular case, we're talking about specifically race relations when it comes to nursing and why representation matters. It could be meaning men in nursing. It could mean minorities in nursing. It could mean transgender in nursing. It could mean you could be gay, or it could be, sexuality. It can be different things in nursing. Representation matters means we need to be more inclusive of whatever the paradigm happens to be. We need to be more inclusive. Basically, that's what it's about. But in this video, I'm specifically talking about inclusiveness of ethnic minorities, and with that being said, inclusiveness throughout the nursing spectrum. And what I mean by that specifically is, if you don't happen to live in an area that is heavily populated with ethnic minorities, so if you are living someone that is less diverse because there's more minorities there than the counterparts, then this video is really not for you per se. I'm actually speaking to more so of the people who live in a area, which is the vast majority of people. If you're not living in Atlanta, not living in Chicago, not living in Detroit, Philly, places like that where it is heavily populated with African Americans specifically. And there's other areas of the world that's heavily populated as well, or America, shall I say, because I'm speaking specifically about America. But this is true elsewhere, I'm sure. But I really want to focus on noticing the demographic of where you work and what people look like where you work. So I often say representation matters. I say that because of the fact that for whatever reason, we as ethnic minorities have been brainwashed, or some of us still have that slave mentality that just because we are doing just as well as our counterparts, that means we are where we really need to be. And truth be told, it may be where you need to be for the moment, but it doesn't mean you stay there or remain stagnant in that area. Representation matters because of the fact that if you don't have people who go beyond where you are, who look like you, people won't know, in the vast majority that's obtainable if they don't have that mindset. I've been told several times I have never met a black doctor nurse. And so what that basically means is, when I say doctor nurse, I'm a registered nurse, but I'm doctorally prepared. So I have earned the title of doctor. So that's why I'm called doctor nurse in some informal situations. Okay. So that's not an official, name, doctor nurse. We call ourselves doctor nurses because of the fact that we have the title of doctor, but we actually are registered nurses in our situation or in our profession. So with that being said, I've been told time and time again. So when I get in front of students and they see me, they're like, wow, I've never met a black doctor nurse. That's why representation matters. Because for me, my personal story is this. I have never seen a black nurse, period, until I got to nursing school. Now, some of you may be like, how have you never seen a black nurse? I have not. Because where I grew up at did not lend itself to seeing black nurses. When I saw black people in a hospital setting, I saw them in dietary. I saw them in housekeeping. And that is the biggest areas I think I saw them at. And for someone like me who grew up in an area like me, that tells me that, okay, this is where I need to be. And then I keep thinking about the fact that when I pursued my nursing BSN, people, when I say I'm going to school to be a nurse, they automatically assumed, and I say assume, that I was going to be an LPN. And again, there is nothing wrong with being an LPN. So this is not that kind of video. Don't come for me about that. There's nothing wrong with being an LPN. But to make the assumption that's the best I'm going to be, or that's all I could be, that's an issue to me, because representation matters. And so if we're not striving for these higher positions, if we're not striving to be practitioners and having education at the doctorate level, you create a precedence that that's all we can be is LPNs, or actually the next best thing, to be honest with you, is the associate's degree nurse, or the ADN nurse, because now that is the next thing. That's the best we can be. So oftentimes when I say I'm going back to school, people say, oh, you want to get your BSN? No, I came in with my BSN. I'm going to get my doctoral degree, or whatever degree I was going to get at the time. Again, because some of you all still have the mentality that this is all I ever want to do, you make other people think this is all we can ever be. And that is really sad if you think about it. We need to get out of the mindset that I'm here because I'm comfortable, because I'm only going to make this much money, and there's no point in me going on to do anything any different. Again, nursing is really not just about you. It's about the people who you care for. And who do you think is making decisions when it comes to ethnic minorities if we don't have a seat at the table? Who do you think that? Who think about this? We have health disparities in our group, right? We have health disparities. So we have issues with heart disease. We have issues with diabetes. We have issues with OB, maternity, morbidity, mortality rates are high for us compared to our counterparts. Well, who is out here fighting for us? Do you really think they are? Do you really think they have a vested interest in the fact of whether we survive these disease processes or not? Do you think they truly have a vested interest to know whether or not we can overcome these health disparities that we have? They don't. Collectively, they don't. You're going to find individuals of any background who care about everything, about everybody. That's not what this is about. I'm talking about the fact that you, who have the ability to do more, choose to do nothing or very little because of the fact that you feel like I'm not going to make any more money. And to a certain degree, you're right. To a certain degree, you're right. So that's your mindset. That is your mindset. I'm not here to really convince you to change your mind. But I do want you to know the whole point of becoming a nurse, really, take the selfish reasons out, is to elevate the plane of nursing, right? It is to make it a focal point to say, okay, we are going to better the health and create positive patient outcomes for everyone. Well, if no one is at the table for us, who is batting for us? Who is talking for us? Who is saying what can we do besides education? Because obviously education is not the end deal to make health disparities go away. What we need researchers. We need people who are like, okay, let's go ahead and let me get into that. I want to know what I can do to save my community. And I have students who I'm definitely encouraging to go beyond the BSN. And I know you're going to like, okay, everybody don't want no doctorate like you. I get that. That's not a problem. That's not a problem at all. I'm not saying that's what you should do. I'm just saying that representation matters. And I'm going to keep on using that hashtag throughout this video. Representation matters. When you see no one who looks like you and you have that same mindset, you are not going to desire to become anything greater than what you are. So again, like I was saying, keep this in mind too. How many of you all have seen a plethora of ethnic minorities in med-surg? How many of you seen that? A plethora. I mean, you go to med-surg, you're going to see all the black people there, right? Not necessarily all of them, but keep in mind of this. This is an opinion, okay? So this is an opinion video. This is not facts. This is an opinion. In my opinion, med-surg to healthcare, it's like McDonald's to the career field, to working. It's an entry-level area. Med-surg, there's nothing wrong with med-surg. Med-surg is really a specialty within itself, okay? Because med-surg has everything there. It's a specialty within itself. What I am trying to say to you is that they want you can come to the party, but they don't want you to sit at the table. And only some of you will understand what that means. And so if you understand what that means, put a comment below that I get it. They let you come to the party, but you can't have a seat at the table. Meaning you can join us, okay? You can join us in nursing, but we're going to designate you to be in certain areas. Have you all noticed, some of you who have started off in med-surg, you had a hard time coming out of that specialty? Again, if you live in an area in which everybody's pretty much ethnic minority, this doesn't apply to you. This applies to the people who who live in a little bit more diverse area, and you may be the minority in that area, and you find that you've been trying to apply for a job in ICU, ER, OB, or whatever for years, and you cannot get a job. Or maybe it's not even that. Maybe it's in case management. Maybe it's in a certain area of nursing in which you have a hard time getting a job, or you don't see you well represented. In OB specifically, I can only speak for OB because I work OB. We are not well represented. Is that by design or by default? It's both. So I was very fortunate to get a job in OB coming out of nursing school, and I'm very, very happy that I did, and I've been here ever since. But OB is not a specialty that we get to go into. And so when I meet someone who is also an ethnic minority who is in OB, it's like we're long lost cousins or friends, and we're like, okay, oh my gosh, where have you been? And you automatically click with that person because you don't see you very often in OB, in any aspect of OB. I know people who just come out of school and they go to their OB unit because they get accepted, they get hired, and they're the only minority there. And then because they are the only minority there, they are ostracized. They are made to feel like they're not as valued, as important. They get a hard time. They don't get told how to do things. They get left behind, and ultimately they quit and they go somewhere else. They go to med-surg or somewhere else where they feel like they're going to be more accepted. That's a problem. That's a problem. Never let someone boot you out of where you really wanted to be. If it didn't work out at that facility, find another facility, but don't change your whole specialty just because it didn't work out there. Unless you feel like this is not the specialty for you, that's something different. But again, hashtag representation matters. It matters because of the fact that if you have nobody who is sitting at the table for you, no one who's speaking to your health disparities in your patient population, if you don't, people don't look like you. So let me give you some statistics real quick. This part is fact. So in the United States, African Americans represent roughly, I want to say 16% of the US population, roughly. In nursing, we represent about less than 10% of the US population of nurses. And that is your LPN, your RN, your advanced practice nurses and all. We represent 10%, less than 10%, but the population, we represent almost 16%. Ethnic minorities collectively, all of us represent roughly almost a third of the population. All right, I'm back. I had to actually go look some stuff up before I actually told you this. So blacks represent roughly, as of 2019, roughly 13% of the US population. The second largest ethnic minority group in the United States, second largest. However, in nursing, like I was saying, we represent less than about 10% of the US population. So there is a disproportionate amount of people who reflect one group, but not another group. So with that being said, who is actually caring for your family members if you're an ethnic minority? Who's caring for them? Your counterparts are. Do they understand truly the situations that you have within your family? Do they understand how African Americans think? Do they understand what the Tuskegee experiment was and why our elders are so distrustworthy of the healthcare system? Do they understand our culture? Do they understand why we eat the food we eat? I'm not saying it's right we eat the food we eat, but do they understand why? Where does it come from? They don't. Unless they have been immersed in our culture, they don't. With that being said, if you decide that you want to just stay at a certain level of nursing, you are feeding into what your counterparts want you to do. They don't want you, most of them don't want you to elevate. And again, this is not a totality thing, because I know plenty of supportive people who do not look like me, who are quite supportive of us advancing. I also know people who look just like me who is not supportive of us advancing. So it goes both ways. It's a double-edged sword, to be honest with you. And so sometimes we are our own worst enemies. And so we always want to play, well, we can't do this, we can't do I don't ever see anybody. Well, why don't you be that agent of change? Why don't you be that person who says, you know what, I'm going to go beyond this, that, and the other. Representation matters. It matters because of the fact that until you decide that you're going to become the CNO, CEO, doctor such and such, CRNA, nurse practitioner, There's nobody to really care for our populations. There's not anybody to care for our population or become a medical doctor. There's no one to care for our populations, because what you're doing at the bedside as an LPN or as an associate degree nurse is wonderful. We need people to take care of those patients. But again, my question to you was, who is going to sit at the table when it comes to going to bat for those patients and our people in our population who are dying from things that other people are not dying from at the same rate? Who do you think stands for that? So I'm only speaking to those who are ready to make that change. If you're not ready to make the change, if this is not for you, then click off the video. It is what it is. I'm really speaking to the people who say, you know what, she's right. I do think representation matters. And if you're not moving up, you're stagnant. If you're not moving up, you're complacent. All these are adjectives. Complacent. You are where they want you to be. They are happy that you are there. Have you ever noticed that people come in? This is a prime example. Let's say, for instance, you are someone who has a bachelor's degree. And I've seen this happen. So I've seen this happen plenty of times. And you want a management position. And the criteria typically is, bachelor's degree with management. But then you have years of experience in management. You have experience, you have years, you have the qualifications, you have the credentials. And someone who doesn't look like you, who have less experience, if any, who have less credentials, they are associate prepared, they go in and get the management position. Do you think that was by design or by default? That was by design, my friend, by design. So again, my point is, you can come to the table, but you can't sit there. Or you can come to the party, but you can't sit at the table. So I want you to know that you being stuck in med-surg is by design. I want you to know that you being having difficulty getting into certain populations of specialties, shall I say, not populations, specialties, is by design for the most part. You having difficulties climbing that ladder. So let's say, for instance, you do get in that specialty, but you've been sitting and waiting for that nurse management position forever. That's by design, that somebody else came in. Usually they hire from within, right? Most places hire internally first, or try to, if you're qualified. Have you ever been in a situation where you all trained your boss? They hired somebody and next thing you know, you were training them? Have you been in a situation where you were training people and they end up coming in at the same level as you, same position or whatever, but they end up being your boss later on? And you trained them to do the position that you were supposed to do? Yeah, that's by design. So again, I'm saying, should we be caught up in the money? Oh, I'm making my money here as a whatever kind of nurse. Let me tell you, with your slave mentality, that's exactly where they want you. That's why they pay you to be there. That's why they make it that way. It's no different. Think about this. This is not the same situation by any means, but it's no different how you have all these athletes getting paid millions of dollars to play the sport. But how many of them own the franchise? How many NFL owners do we have? How many of them own the franchise, but how many of them play the game? They make good money. Oh, they make millions. I ain't knocking them. They making money. They making bank. How many own the franchise? I'll wait. Hopefully you see my point. Again, you can come to the party, but you don't get a seat at the table. That is by design. Now, there may be some other sports. I'll just use football as an example. But there could be some other sports where there are franchise owners who are minority. But even still, how many of them is it compared to how many play the game? How many franchise owners do you know in any sport, whether it be basketball, hockey, whatever y'all happen to be into? How many franchise owners who look like you or me own a team versus how many play the sport? It's disproportionate, is it not? Same thing in nursing. So that was just an analogy for those who like sports or somebody who have a better understanding of how things work. How many of us actually own or run our own businesses as nurses, or even not even as nurses privately? How many of us do that? So when I keep coming on these videos talking about why representation matters and why I'm pushing you all, hopefully, to move to the next level, hopefully you understand why. Because otherwise you feed into the narrative that they want you to feed into. They're like, yeah, come on, come on, come on. We want people. We want it to be more diverse. How many places have you? We want you to be more diverse. However, we only want you to be at this level. We don't want you to rise to be a CEO or a CNO of or a director of a unit. Now, again, like I just told you, if you live in one of those areas that have, it's just heavily populated with African Americans anyway, then this is not really about you because you have what you have. But at the same time, it's because of the fact that there's nobody else or there's not many of them there. Okay. I'm really speaking to the ones where do they make you feel like you have an equal playing field? Do they, many of you who you grew up in areas that have a quite diverse background, you probably or have a heavily ethnic minority background, you are used to seeing black nurses. I've never seen one until I actually got to nursing school and one of my instructors, which is another thing. How many instructors do you all have that are ethnic minorities? That's not at HBCU. That's not at a HBCU. Let me go ahead and put that out there. How many minorities do you have had as nursing instructors that were minority or that were even men? Representation matters. Or even not just black, but what about something else? Vietnamese, Asian, some type of Asian descent, some type of Hispanic. How many have you seen of that? How many instructors have you had of that? You probably haven't had that many unless you went to a HBCU. So what I'm saying is representation matters. We have to know our place and we have to know that we don't have to settle for certain things, which is what they want us to do. And so I want to impress upon you the importance of you striving for more and doing so in such a way that you set the bar so that other people who come back and look like you can say, okay, no, I know a black nurse. I know a black CEO. I know a black CNO. I know a black doctor nurse. I know someone who is well educated, well spoken, but can listen to trap music at the same time on the way to work. So be it. If that's you, be it. That doesn't mean, so for those of you who feel like, okay, well, I have a certain personality, I have this, that, and the other. Okay, that's cool. I do too. I have a certain personality, but I know how to turn whatever on and off depending on where I'm at the point in time. I can sit with the CEOs. I can sit at the corner store. I can do both. Okay. Get you one that can do both. So that's kind of what I'm saying. Don't let that be, we always want to downplay our education. We always want to downplay how smart we are. Don't fall into that trap either. Also, when I sit there and say people are trying to keep you back, representation matters. I'm also talking about your own people who do the same thing to try to keep you back. Those people used to hang with, go to the club with every Saturday night. That club's still going to be there. As a matter of fact, the same people are going to be there when you get back to it a year or two later. It's going to be there. It's time to elevate the plane. It's time to move on. And sometimes people can't move with you. And that's what you have to understand. Some people cannot move with you. They have to stay where they are and you move by yourself. You will lose people along the way and that's okay. But you have to be able to move and move forward. That's what you need to be able to do. And so hashtag representation matters because we need more ethnic minorities, not just blacks, but ethnic minorities who are truly going to elevate the plane of nursing by moving forward and saying, okay, you know what? I'm going to do the best I can to make sure that the people I love and care about is well cared for. And what that basically means is you can't sit at the bedside just taking care of them, but we have to do some research to find out what's going on with us and our population to make those changes, to talk to those pharmaceutical companies, to sit there and do the research, to make sure that our physicians are actually doing what they're supposed to do when they do their assessments, when they do their when they do their prescriptions. Do they really check to see? Here's an example. Serena Williams is someone who, as you know, who is a tennis athlete, had a baby, and her words was she almost died due to a complication within her pregnancy or delivery. So money doesn't matter. It doesn't fact that she has money. She has more money than I do, obviously. Okay. It doesn't matter. It's something within our DNA that predisposes us to having unfavorable outcomes in a lot of situations or increased health disparities. But who is out here really sitting at the table saying, let me fight for my own people? When the opportunity comes, you need to be able to slide those credentials across the table because you're ready for it. That's what I'm able to do. My area may not be research. I don't do research. But my area of representation is in education because I only had one black instructor. I have had I have 4 degrees. 4. And in 4 degrees in college, okay, that is roughly what, 12? Let me see. I took 5 years for the first degree, 2 years for the second. That's 7, 8, 9, 10, 11, 12, 13 years worth of education. 13 years worth of post-secondary education. In 13 years of education, I can count on one hand how many black instructors I've had, pre-nursing and beyond. So I had one history instructor who was black, and I've had one nursing instructor who was black. That is 4 degrees, 13 years of education. I've had 2 people who taught me who looked like me. Why is that okay? I did actually, in terms of minority, when I took Spanish, of course, the person who taught Spanish was someone who is native, Hispanic, you know. So he was Puerto Rican. So with that being said, of course, I had 3 minorities. Okay. Why is it like that? People don't want to go into education. I get that. But education is not the only place that you can be, especially in nursing, that can lend itself to you advancing the plight of nursing, or elevating the plane, shall I say, of nursing. That's the only place you can be. You may decide that you want to be a practitioner. You want to be a hands-on type of person. You want to take care of the actual patient. You may decide that you want to do research and figure out why it is we having these problems. You may decide you want to go into pharmaceuticals and see how these medications interact with our other medications and our DNA to why things don't work with us as well as they do with other people. Why do you think for the COVID vaccine, they needed minorities to take the vaccine? Because our DNA is different. We're different. They needed ethnic minorities to sign up to take the vaccine. Why? Because they needed to see how it impacted African American or ethnic minorities in general. That's why they put that call out. We need more ethnic minorities. They said African Americans and Hispanics is what they said on the news here anyway, to take that vaccine. Why? Because things affect us differently. So with that being said, I want you to understand #representation matters. It matters whether you are a student. It matters whether you are a bedside nurse. It matters whether you are in a CNO position, you in a advanced nurse practitioner position, whether you're in academia like me. People need to see that we exist and we out here. They need to see that we are just as intelligent as everyone else. They need to see that we actually care about our health care of our people, and we need to do that to advance the plane. So with that being said, if you are still one of those people who say, you know what, I want to stay because I'm making X amount of money. Okay, like I told you in my options video, okay, when you 70 years old, and you still at the bedside talking about you making 6 figures and your back broke down and your knees is broke down, and you still working every other holiday, weekends, whatever your schedule happen to be, 12-hour shifts. Now again, I say all that, but there's some people that truly that is their calling. So I will say that. Let me digress a little bit. The bedside nursing is truly some people's calling. I'm not really talking about those people. When it's your calling, it's your calling. I've met someone who actually can say that that's her calling. Like this is, she's an LPN. And she's been an LPN as long as I've been alive. So she's been an LPN for 42 years. She had no desire to go back and things like that. But she is truly doing what she's being called to do. I have to admit there are nurses who are just made to do that. They are born, they are born to be that bedside nurse, and they will do that till they retire. I'm not really speaking to those because we do need people at the bedside who look like us. That's not what I'm saying in this video. What I'm really saying in this video is we need people who say, okay, yes, I know this is my starting place, but that's not my ending place. I really want to create a change. I really want to do something different. I really want to elevate the plane by saying, I want people to see that I am here. I want, how do you think we're going to get our ratios different? Maybe your issue is staffing ratios, and maybe you want to be someone who sits at the table with the CEOs and CNOs and say, okay, we got to do something about this staffing situation right here. We need more minorities in specialty areas. We need more minorities in academia. In order for us to get more minorities in any of those areas, let me tell you what I'm doing to change or elevate the plane of nursing. In order to get more minorities in those areas, in nursing, bedside and beyond, it starts with me, the educator. We have to have them in education first. We have to have them in the classroom first, and we have to have them succeed. That's where I come in at. That's why I know where my calling is. I love being a bedside nurse too. I didn't love it. Okay. I knew my calling was education. And now that I'm at HBCU and I can see my students who look like me, who aspire to be, they say to me, I never knew there was a such thing as a nurse who has a doctoral degree. They never knew it. They never saw it. Until now, they see it. Representation matters. Thank you so much for watching this video. Follow me on IG if you so choose. Until the next time, take care. Bye-bye.